So I'm very excited. We have three speakers with us to deliver our presentation for today. So first off, we have Dr. Christian Schulz-Quach, and Dr. Christian is a psychiatrist at Princess Margaret Cancer Centre. He's a psychotherapist and a palliative care physician and educator. Christian was born in East Berlin and grew up in Germany. He has lived in Switzerland, the US, the UK, and most recently in Canada. Next slide, please. We also have with us Margo Kennedy, and Margo is a social worker at Princess Margaret. She is driven by her passion for health equity issues, and her extensive experience in cancer care has provided a deep appreciation for the many stresses, barriers, and challenges that patients may encounter. Next slide, please. We also have with us Brendan Liver. Brendan is a neuroscience student at the University of Toronto and a research student at Princess Margaret Cancer Centre. He's also the social media coordinator for the Sexual and Gender Diversity in Cancer Care Working Group, and his research interests include health equity, developmental neuroscience, and immunology. So with that, I'm very pleased to pass it along to our group today for our presentation. And thank you so much for being here with us.
Great. Well, thank you so much for the invitation. And it's really our honor and privilege to be with all of our Wellspring friends tonight. So thank you so much for logging on, I'm sure at the end of a busy day. Maybe to start off with, we'll just take a moment to explain the name of our working group, which is the Sexual and Gender Diversity in Cancer Care. And probably people are more familiar with the acronym 2S LGBTQIA+. That's quite a mouthful to say. I know I've practiced trying to say it really quickly and I don't always get it perfect. So we went with sexual and gender diversity, just thinking that it would be a little bit easier for people in terms of language. And a lot of the universities, the different student centers are using SGC, sexual and gender diversity as part of their diversity programs. So hopefully it will become a little bit more common. So great, so next slide. So we're hoping that today we will be able to tell you a little bit about some of the changing culture at the Princess Margaret and why our group came together, the challenges patients face, what some of the goals are, how social media has been working to create change, how patients might be able to improve some of their care experiences, and very importantly, to maybe get some feedback from you about questions you have and input that you have for us about what you think would be really important. So just take a moment to, I was thinking back how I started at UHN, I can't believe it, 20 years ago this month. And I recall when I started, it was such a big culture shift for me. I was working in women's services and then I came into healthcare, working at a hospital. And before that time, I had hardly even set foot in a hospital. So it was this huge culture change for me. And there was I think two things that really struck me when I started working at the hospital. The first one was being inundated with so many acronyms, and I didn't know what any of them meant. I remember my first shift in the emergency department seeing this great big huge whiteboard up on the wall, and this was before they used electronic whiteboards, and seeing patients' names and then all these acronyms after their name. And I remember standing there looking at the board and seeing so many patients where they had SOB written after their name. And I thought, SOB, that's not very nice. Like, oh, what am I doing here? What kind of place is this? And then I found out that stood for shortness of breath. So I was really relieved. The other thing I noticed coming into the hospital was feeling this huge contrast from working in women's services, where I worked with people who were very transparent and very out about who they were. and really free to express, whether they were gay or lesbian or queer or trans or however they identified themselves. And when I came into the hospital, it was so different. And I noticed that nobody ever mentioned that, ever. And I thought, boy, where are all my people? Like, why don't the staff talk about this? Why don't patients talk about this? And I naively asked one of the managers I worked with one day about it. And I recall her being horrified and saying, no, of course we don't talk about that. That's got nothing to do with healthcare. And I remember thinking like, wow, this is going to be an interesting ride. And it has been for 20 years. But today I have to say that there's so much support and engagement and momentum and excitement about beginning to address sexual and gender diversity in cancer. And we're hoping that tonight we can share some of the big changes that we've been seeing and working towards, and some of the joy and excitement that we're feeling. So if we look at even 2 years ago today, before our SGDC program started, there was no pride flag hanging up in the month of June. There was absolutely no specific information or resources for patients or their chosen family. And I mean, not one brochure with a rainbow anywhere. There was no environmental indicators like a flag or a poster or images that reflected diversity. And there was very limited staff support and engagement around the whole issue. And now when we see the lobby, this June, there was a huge flag. This picture doesn't even do it justice, but it was this gorgeous pride flag hanging up right when you walked into the hospital. So that was great.
Adding on to that, another thing we've been trying to do to change the culture at Princess Margaret has been providing more resources and specific information for patients and their family. So since the beginning of the SGDC, we've been able to put up a website. And on top of that, we've provided resources such as a cancer care resource guide, social media pages such as Instagram and Twitter, and other resources such as pronouns guides to sort of educate healthcare providers and different workers at the hospital. On top of that, we've been doing our best to include inclusive environmental indicators, such as pride flags when you walk in at screening booths, different employees wearing pride lanyards, as you see us wearing today, and also more presentations. So last Pride Month, we did a presentation and the slides were posted on different TV screens around Princess Margaret, on websites, and it's been very good. We've been getting a lot of great reception from it, and Margo can add on to that part.
So I was so excited that we were able to, this slide actually kind of went up on these really big screens all around Princess Margaret. And I thought like, wow, conservative Princess Margaret now has a picture of these two men kissing and celebrating Pride. It was such a great thing. So we can see how things have been changing so much in terms of, this is a photo during Pride Month of screeners and staff. And I don't know if you can really see too clearly, but they're wearing Pride masks. So that was really neat. This is a quick little photo from one of the hematology clinics of, they decorated a door and they have this conductor guy, and he's been holding that pride flag, I think, well, for a good 1.5 years now. So that's just amazing. I'm so glad when things stay up all year and don't just come down at the end of June. And the staff did that out of their own initiative with no prompting from us. We were also so appreciative that our work was recognized by UHN, and this year our working group received an Outstanding Contribution to Education Award. So I think those are all signs of how the culture has really been dramatically changing over the past 1.5 years since we started. So why did we start our working group? I guess, first of all, we wanted to address the silence and invisibility of sexual and gender diversity and cancer. We were noticing that there was really very little discussion or attention that was being paid to this issue. So that was one of our driving reasons for starting. The second reason was we wanted to really improve the cancer care experience for our patients and their chosen families. And we know when there's not much discussion or attention paid to an issue, that there's usually some room for improvement. Another really important reason was that our group had a really strong passion and desire to want to start changing the culture of healthcare. And we really wanted to do that in a very strategic way that would make significant and lasting change. So Christian has been our real mastermind on how to unroll that and do that. We also wanted to improve healthcare providers' awareness and education related to 2S LGBTQIA+ issues. And then the fifth reason was to provide more research dedicated to our SGDC cancer-related community and topics. Anything you want to add, Christian?
No, that's fine. I go on to the next slide because this really shows who we are as a team and as a group. And I don't know who's doing the slides. Can you do the next slide, please?
Yep.
Thank you very much. So yeah, that's our group. As you can see, we're an interprofessional group, a group of team members from all angles and backgrounds. What's most important and most fascinating for us, we didn't really have to do much. When we started our project, Margo and I, over a cup of tea, we very quickly had people join our group asking us, actively sending us emails and asking, we heard you're planning something, you're doing something, can we be part of this? And this group is a group of volunteers. No one really has their main job so far in our sexual and gender diversity in cancer care working group, but everyone is working towards a common goal with our two main philosophies of safety and collaboration. So why does SGDC matter? I don't think that tonight is supposed to be a huge academic presentation with, you know, a lot of numbers, but we want to just share a few numbers with you because they are also the numbers that we experience on a day-to-day basis when talking and thinking about sexual and gender diversity in cancer care. So there is, I think I want to go to the middle tile with the gray background, which is the main aspect that I think was stunning for us. In looking at the research throughout, there is a lot of actual comfort in healthcare workers and healthcare providers in treating patients with a background here, LGBT, because this is one slightly older meta-analysis or systematic review that basically sexual and gender diverse population in cancer care. But only 8% of the same people who were asked about their level of comfort felt confident in having the specific knowledge of how to communicate about those four main domains that we typically talk about within sexual and gender diverse communities. So for us, how we have defined it, this is pronouns, this is gender diversity, sexual orientation, and relationship diversity. So how do I actually talk to someone about this in the context of healthcare and do it in a way that is not intrusive, that also doesn't make assumptions, because not everyone who self-identifies under the umbrella needs care because of their identity. Very often they have an identity and come for the same care that anyone would come to in a comprehensive cancer center for cancer treatment. And so it is important to also strike a fine balance between how much information do I actually need to ask about, how much information is actually not relevant for the healthcare that I'm trying to provide. We also, on the right side, I want to talk to you about the specific group of transgender folks. There was a very recent study of almost 30,000 transgender people done in the United States, our neighbors, and almost 1/3 of them reported at least one negative experience with healthcare providers in the past year alone, which is significant because we need to keep in mind that a large percentage of transgender folks don't even access healthcare because of their fear of negative experiences. So even those who were brave enough and courageous enough to seek care, 1/3 of them actually had negative identity-related experiences. I'm not going to go through all of the numbers, but what we're basically trying to show with this slide here is that there is a lot of research evidence, and over the last 10 years, it has exploded. It really has mushroomed. We have a lot of very good, profound data available that shows us that there is an actual gap and an actual need for understanding better why healthcare is accessed at a lower frequency, with less success rates, with higher mortality risk, and with higher risk in general amongst those who are part of sexual and gender diverse populations. And because we have a lot of high-level evidence, so evidence that's around the globe relatively consistent, we were trying to look closer at what can we do locally and provincially to improve our care here in the Princess Margaret Cancer Centre. Next slide.
Great. So this slide, we wanted to maybe share a little bit about what a conversation between two patients might look like in a waiting room. And, you know, when we go into the hospital, very often we wait for quite a long time. It's a long wait. And so while you're waiting, often the natural thing to do is to connect with maybe somebody else in the waiting room and to compare stories. So here's an example of maybe what some of the discussion questions and the conversation might look like between two patients. So the patients might be exploring whether or not they've ever had a healthcare provider seem uncomfortable, awkward because of your sexual orientation or gender identity. They might be talking about whether or not they've ever experienced being misgendered, either themselves or maybe someone from their chosen family, and just how maybe hurtful that could be. They might be talking a little bit about whether or not that their family or their chosen family were ever made to feel unwelcome at the hospital. Whether or not they've ever been the only queer person in a cancer support group. Whether or not they've ever experienced discrimination from a healthcare provider. And whether or not they've ever experienced a microaggression at the hospital. So these are some of the, just a quick little snapshot of some of the important questions that patients might ask, and practical things like, you know, have you been able to find the all gender washroom here in the hospital? And these are questions that heterosexual patients, when they walk in our doors, don't need to be worrying about, and are certainly not on that person's mind. So these are some of the things that can make the experience more stressful. It's already stressful enough having cancer, but then having these extra stresses on top can be quite significant. So the way they play out in terms of research are, this slide represents the top 10 themes that research has indicated that are quite significant to sexual and gender diverse patients. So we're not going to talk about each one of these things, but maybe just very briefly, we could touch on maybe a few examples and how they really relate to the experience of cancer care. So in terms of heteronormative practices of care, you know, I think we can think, well, the whole world is very heteronormative, that it assumes that everybody is cisgender and heterosexual. What this might mean for someone being treated for cancer, though, could be, let's say looking at a patient who comes into the hospital. He's been coming for, a year and a half. He identifies as a cisgender gay male. He's been in a long-term relationship. He's married to his partner and they have a child. And he's done really well with his treatment. He loves his oncologist, but he did notice that even though he used very gender neutral, very gender neutral language in talking about his partner, the oncologist never picked up on that and always assumed he was in a heterosexual relationship and actually talked about his partner or his spouse as his wife. And then maybe something changes in this patient's cancer care and the oncologist says, I want you to come in next week with your wife and be sure you come with your wife. I really want to talk to you and your wife about this clinical trial. And the patient might be thinking like, oh boy, maybe I should have corrected the doctor like a year ago and I never did. And now it's so awkward. So I'm not going to bring my husband to the appointment next week. And then that patient is really missing out on such valuable care and support they would really benefit from. Another example might be maybe another patient, a trans patient who's coming in for radiation and has 8 weeks of radiation, 5 days a week, a really grueling schedule. And that patient might find that, it's so difficult because they come into the radiation area and they didn't get their health card changed yet. So the name on their health card isn't the name that they identify with. It's their, it's their dead name, you could say. And when they get called in for their treatment, it's not a beeper system. One of the radiation team members comes out and just kind of calls out your first name to this big waiting room. So this patient, when their name is called, not the name that they go by, but the name on their health card is called, they have to stand up and walk right across the waiting room and just hope that no patient says, oh, no, they just called Sally, you can sit down, because, maybe this patient doesn't look anything like a Sally. So from the get-go, things are starting off on the wrong foot and it's awkward, it's uncomfortable. People can feel like really frustrated and really angry and humiliated, and it's horrible. And then they go for the radiation treatment and the whole radiation team is awkward and uncomfortable and it's just so weird. And then the patient might be putting forward all of this energy to try to, joke around to make the team kind of feel relaxed and, and it's just so hard. And, halfway through their treatment, they're being slammed by all the side effects. And, I bet there's some days where they get out of bed and think like, I just cannot face going in for the treatment, not only for all the kind of the physical reasons, but also emotionally. And just sort of dealing with this is just so hard. So they might start to miss appointments. And then they might start having, sort of these lectures from the team about missing appointments. And then it might get written in their healthcare record that they're not being compliant with their treatment plan. And then they might worry whether or not their, insurance providers will ever read that record and stop their, short-term disability insurance payments or something. So it just sort of goes on and on and on. And it's not the patient's fault. It's the system that's making it so difficult. It's the same with here, the apprehension due to discriminating clinical experiences. It's not the apprehension that's the problem. It's really the discrimination is the problem. Of course, people are going to have a sort of worries about discrimination. So those are some examples of what this has to do with cancer and how it's a little bit different. Another thought is, what makes it different is that, let's say if you, stub your toe and you break your toe and you go to an emergency department, it probably isn't crucial to tell the team about your sexual orientation or gender identity or have that asked, because you're only seeing this healthcare provider once, and your toe may have absolutely nothing to do with your care. But with cancer care, it can be much different, and that you're likely to have a much longer term ongoing relationship with that healthcare provider, and things can change and come up that might really drastically impact your care. I guess that being said, if you were a non-binary or a trans patient and were going to the emerge with a broken toe, there probably would be a risk of, being treated really poorly by the healthcare staff. But, generally speaking, if you identify as a cisgender person, that it might be something that's really not relevant to your care. Does that make sense?
Totally. And I just want to emphasize again, Margo, because I also want to be sure that we're not putting the wrong emphasis. Again, we just did actually start a survey process, a needs assessment here within UHN around healthcare providers' knowledge and interest in gaining more knowledge on how to communicate with sexual and gender diverse populations. The vast majority of those we are talking to are genuinely highly attuned and interested in learning more. However, similar to what I presented before in our slides, many people are awkward and uncomfortable about how to address, how to speak about, and how to actually ask in a respectful and meaningful way at the same time about those 4 main domains that I mentioned before: pronouns, sexual orientation, gender identity, and relationship diversity. Just wanted to add that on. So there is just a gap between willingness and skillfulness in addressing these topics.
Great, thank you for that. So the way these challenges impact patients are very predictable and expected in terms of they increase isolation, stress. Patients feel they need to educate healthcare providers at times. Patients report lower satisfaction rates with their care, avoidance of healthcare, poor outcomes, delayed cancer screening, more advanced cancer at diagnosis, and unmet needs.
And I really want to emphasize here the great point, the point of patients feel the need to educate healthcare providers. This is actually what our group is trying to change. We're trying to make a change in the culture at UHN and at Princess Margaret in particular, because the last thing any person who is experiencing potentially life-threatening or existentially anxiety-provoking illness should have to be the educator for others about so profound and important things like identity and relationship diversity. So what are then our goals in our program? And I hope some of you who are listening to us have a few questions as well. And we also want to invite critical questions, by the way. We're still wrapping our head around how we can best support and how we actually can provide the best services. So please speak up and let us know if you have specific questions or recommendations, suggestions, or maybe even personal experiences. We do, on the one hand, want to disseminate, just as we do tonight, by talking about and providing information about our data that we are gathering, this topic and bring it into the broader public. But we also want to be very clear that we don't want to stop there, but we want to really change the culture. And culture cannot be changed in a 30 minutes unconscious bias module on sexual and gender diversity. It's something that takes time. It is something that needs to be more than an online learning module. But it can start with something like a dedicated online module that helps us address those 4 domains that I'm not going to repeat again because I'm going to be boring. So that's one aspect we're focusing on. How can education help? Mindful of the fact that education alone will not change culture in any organization. What we've already started doing and what really is an important aspect of our work is navigation. So we ask ourselves often the question, so is there a risk that because we've now founded a sexual and gender diversity in cancer care group, that we get referrals for cancer patients based on the fact that they belong to a sexual and gender diverse population, which should not be the case. Because again, everyone comes to a cancer center because they want cancer care treatment. So the question then is, what could be the specific services that we could be offering? And navigation seems to be one particular element, allowing those who have questions or who need specific support or have specific challenges to really find the community resources that are available. And there is an abundant list of really wonderful NGO and volunteer services, and some of them also professional services that are available. Actually, I was very impressed after Margo started creating our resource booklet, how much is out there in the community, but not all of it is known and well connected. And I want to take this opportunity to very quickly also address our colleagues from across Canada from Queering Cancer, who are official collaboration partners of ours. Queering Cancer is an initiative that is older than our own, and you can look them up online. You can look them up on their own Twitter and Instagram and website handles. Their logo is down there next to the UHN logo. And they provide online material across Canada for regions outside of Ontario. So far from my end on this slide, Margo, Brendan, anything to add?
No, it's good.
Good. All right. So next thing we're going to talk about a little bit is social media. So as I mentioned earlier, about 3 months ago now, and around November, we started a Twitter and Instagram page. So some of our main goals was just to connect with patients, caregivers, healthcare providers, and other organizations. And honestly, it's been going great so far. We've had a few cancer survivors reach out to us and let us know how happy they are that we've been trying to do this for them. We've had other organizations that have similar goals reach out to us, such as Inclusive Care Project and EGAL Canada, and they like to collaborate with us. Because one thing that's unique about us is there's a lot of pride groups on social media, there's a lot of cancer groups on social media, but there's not so much that does do both, right? Like, it's usually specific to one, but not both of them. So we've been trying to cater to that, the SGDC community, provide them with resources and tips for patients. So during the holiday season, we published this holiday guide that sort of gave tips for the SGDC community to get through the holidays in certain situations that maybe heterosexual patients won't be going through. We're also trying to put out some information that's tailored specifically for SGDC patients, and educate healthcare providers in a different medium. So especially healthcare providers, they may be busy already reading enough research papers, enough textbooks. They may want to be educated in a lighter way. So using social media is a great way to do that, because it's just something light that they can look at quickly, look at any time, and it won't take much of their time, right? We'd love it if you guys could check us out. Both our Twitter and Instagram handles is PM Chosen Family. Yeah, and so one of the ways we've been trying to educate healthcare providers is weekly posts. One of those posts being the Mondays Challenge. So for this post, it's a 4-page series where the first page sort of poses a question such as, how does heteronormative language affect my patient? And it'll give an example of a challenge that patients may face due to heteronormativity by healthcare providers. And then the type of impact it'll have on the patient, and then giving a solution of what the healthcare provider can do to avoid this and make sure their patient has the best cancer care experience possible. So we're trying to educate healthcare providers on how to give inclusive care, but we're also providing affirmations and comfort to patients and letting them know that, like, we know what they're going through, we know what experiences they may have faced, and we're trying to make sure that doesn't happen again by educating these healthcare providers. And lastly, it's trying to give patients an idea of what we think inclusive care should look like. And then another series we've been doing is called Thursday's Research. And this provides SGDC cancer research every single week. Again, there's a lot of research on cancer, but not so much that's specific to SGDC patients. So we've been trying to shed light on that, recognize the work that's been done by researchers, and there's been so many great papers that a lot of them go under the radar. So we've been trying to put a spotlight on that. And then healthcare providers and researchers can check these out, see what maybe they've been missing, and learn a little bit. Then on top of that, we're trying to sort of indicate to SGDC patients that there are efforts being made to try to improve their care, to try to educate others, and that they are getting the attention that they deserve. Lastly, so there are some things that we think could help patients sometimes with healthcare providers, such as joining resource groups that are specific to them, asking healthcare providers about resources such as that, like our resource booklet that will provide them with these tailored resources. There's things you can do, like such as completing a power of attorney document, so then they know who your chosen decision maker is and they go to your chosen family. Possibly making an info card with your name, your pronouns, and any important information, so then you're not always repeating yourself, repeating your pronouns due to the assumptions of your healthcare provider. Bringing someone for support can help a lot, and they can sort of advocate for you. Make sure you're not dealing with any microaggressions. And then lastly, don't be afraid to ask healthcare providers questions specific about sex after treatment that may be specific for someone, say, who had treatment for prostate cancer. And Margo, is there anything you want to add to this?
No, I think you did a good job. And, you know, these are just, you know, some basic ideas, but I think they can be really helpful. And, you know, again, I think over and over again, a message that we hope we can leave people with is the importance of connecting and not doing this on your own. And, you know, even if you can't find somebody at your cancer center to connect with, then reach out to the community.
Thank you very much. And I'm also really wondering if any of you out there has anything that you want to share with us, anything you have experienced or suggestions you have that we haven't picked up on so far. We have already one interesting comment that we will go to in the Q&A in just a second. Just checking with Brendan, I think we have one more slide.
Nope.
Okay, that's it. That's the one I was waiting for, exactly, because that's part of our team. That's just our summary. And again, our philosophy as a group is to create safety as a group and community, but also to collaborate as a community within our evolving program. So thank you all very much for listening, for being here. Please, if anyone has any further comments or questions you want to ask, please go ahead and type them in now. And I don't know, I just want to speak to the coordinator. Can I start as reading out the one question we have so far?
Yes, of course. I just wanted to say a huge thank you for your presentation. You guys covered so many key important things, and I think it was such an inclusive, and I think it's very nice to have this information presented, and very important to know that, you know, people can relate to this information and feel connected through this effort too. So I just wanted to say a thank you before you can go ahead with the question, Christian.
Fantastic, thank you very much. And also want to just express it here in the recording as well. Margo Kennedy and Brendan Liver really are crucial members of the core team who have been investing an enormous amount of time in getting everything set up. This was an absolutely amazing journey already, and it was meaning making for me and for others in the team over the last 18 months, which I think for all of us here, no matter which position or role we have been really, really challenging and a struggle at times. So one of the first questions that or comments that came in from an anonymous attendee, where I'm going to read it out. I have tried repeatedly to tell my doctors and their staff it's okay to call me by my first name and that I'm not married, by choice and prefer to be called Ms. If they can't force themselves to use my first name. It would be so nice if preferred titles or new chosen names could appear at the top of our on-screen charts and whatever they print out. Now, I just want to let you know that, first of all, I thank you very much for this comment. You're making an extremely important comment, because how can we actually change our culture in a healthcare system if we don't think about the IT system as well? At the moment, for example, we don't even know, because of the limitation of some of the patient or healthcare information systems that we're using, which patient has which sexual orientation or gender identity or pronouns, as long as they are willing to share them within the healthcare system. We are currently at UHN in a huge transformation process, which actually is going to come to a significant point in June, so early summer this year, where we're going to transform to a completely new IT system. And we do have a working group, and we're part of this working group that very actively is not just advocating, but at the moment already discussing concrete and specific solutions to exactly this question. So we will in the future have the ability to make it very clear what pronouns, what, I don't want to call it preferred name, but the name of the person is. And we are also able to be relatively clear about the other aspects and domains that are relevant in sexual and gender diversity, as long as the patient has given consent to sharing them within the system. So I'm quite excited about this, because what you are addressing is actually exactly what we've been discussing over the last 12 months. And I'm very hopeful that we're going to see a completely new IT system that will be streamlined around those thoughts. We have 4 further comments or questions, and I'll just go through them and see, maybe Brandon or Margo, whether you can answer some of them. So Catherine Jones asks, is the resource guide on the website somewhere? I'm so thankful to learn it exists. Well, Margo, maybe you want to answer this one.
Sure. So yes, if you go to our website and scroll down, you'll be able to click a link to access the resource guide. This resource guide is always under development. I think since we first put it on the internet last June, since that time, we have added 20 more resources to it, but they're actually not in the version that's on the web. One of our goals in the coming year is to have it in a format where it can be updated by our team very easily, and to be more of a live kind of document. It's turned into like this kind of massive book right now. But we're hoping that we'll be able to refine it and just keep building on it more and more. So yeah, there's some good stuff in there. It's divided up into sections, and I hope that you'll find what you're looking for.
Thank you so much, Margo. And then an anonymous comment, and thank you all for all this amazing work you've done that's affected positive change, I think change at PMH. We really appreciate this positive comment. It's reassuring for us as well, because again, we want to be very clear. We're not coming in as experts per se. We're coming in as people who self-identify as part of the SGDC community, who are also self-identifying as being hugely interested in health equity and health access matters. And we're trying to, at the moment, wrap our head around the question of what's really needed. What would a sexual and gender diversity in cancer care program actually look like? And so if you are willing and interested to give us your input and your feedback, if any of you is potentially a patient at UHN, please reach out to us, because we are currently conducting a needs assessment where we're trying to really get the local information, the local data, to better understand how our overall program should look like in the future. Craig asked a question, Brendan, you can maybe answer. How do I obtain a printed or PDF copy of the SGDC guide to resources in the community?
Yeah, so we have the PDF copy on the website, and also if you go to our social media and click on the link in our bio, that'll direct you to a link for the resource guide. We're I don't think we have any printed versions at the moment, but the PDF version is on our website and a link on it on our social media.
Yeah. And we did that kind of on purpose because there's also, you know, the whole question of COVID-19 at the moment. But Brendan, you were very young and quick about a click on the bio. Can you maybe just a little bit slower explain that if someone goes to Twitter, what's the next step they're going to do to get to the PDF version?
Yeah, for sure. So with that, if you look at our bio, there should be a link at the bottom that says link tree, which sounds a little weird at first, but once you click on the link tree link, you'll see a few boxes, and one of the boxes will say resource guide. And as soon as you click on that, it'll get there.
Okay, and Craig, sorry, Craig is asking about the website address, please. And I think the easiest way of how we can help Craig here, because he's not using Twitter or Instagram, is probably, let me see, if you just, Craig, type in sexual and gender diversity in cancer and then Princess Margaret, you will immediately find our website. So you can just Google it. And maybe you do it right now and give us just a little confirmation that you've actually found our website. Okay, thank you, Craig. So that's that. We then have Catherine Jones again saying, I think, of course, it's helpful to educate clinicians, but please also include training of admin folks as well. Reception on the 5th floor and with my surgeon always mention my husband. Huge assumption here. Okay, Margo, maybe you want to speak to this one.
Yeah, that's a very, very good point. And, you know, I think I didn't always use the right language in this presentation tonight, too. I think it's a matter of training absolutely everyone in the hospital, because everybody at some point is interacting with patients and families. So I think that really is key, that very often we get very focused on doctors and nurses, but very importantly, it's the people in the patient flow coordinators in the clinic who are registering patients, or kind of the people, the security people at the door. Absolutely everybody has a really crucial role to play in helping to develop an environment where people feel very included and welcomed.
Thank you very much. And here a very topical question from Colorectal Cancer Canada. I understand that often trans and gender non-conforming patients face the greatest challenge when they are diagnosed with a sex-specific cancer, such as ovarian or prostate cancer. Has your group given any consideration to how to degender or make the treatment of these diseases more inclusive? Now, maybe I'll take advantage of answering here and just say this is such an important and helpful question. But I also want to be honest, that is the answer to that question is what we want to find out. We're not there yet. We want to find out how we can do this best. And one way of how we have conceptualized it is that we want to, again, going back to the idea of navigation, we don't want to create a specific, if you will, non-binary prostate cancer clinic, but rather we want to work together with the prostate cancer program and the sexual health program and find champions within this program who will get special training and special insight into how to address in a non-gendered and non-sex specific way, particular cancer types and cancer treatment. So that when someone addresses us from the trans community and wants our support and guidance, we're not saying we have the better clinic, but rather we're saying we're collaborating with the prostate cancer program at UHM, and we have just the person for you who is well established and also knows how to work with you in an inclusive and highly respectful way. And they're also a cool person. So that's my answer at this point. Craig has informed us that he found the website. Craig, thank you so much. That's very helpful, and please share it. We always want feedback as well. Don't hesitate sending us an email if something doesn't work or doesn't feel right or a resource is outdated. We are trying to be on top of this, but things change fast. And then there is a last and probably also final comment or question actually from an anonymous attendee. Are there any opportunities for LGBTQIA2S plus UHN patients to connect with one another? Now, that's a very good one. And I will say two things, and I think it's very important to also mention this at the end of our presentation. We are very much focused on cancer care. That's why we also call our group SGDC. And that's where we're coming from, Princess Margaret. We have a very active community of LGBTQ2S healthcare providers in the larger UHN organization. And this committee actually is thinking about how to better network and how to better offer support group options for patients in the wider context of UHN. If your question is related to sexual and gender diversity in cancer care, then our question to you would be, do you believe that there is a need and an interest in having sexual and gender diverse support groups? Would that be an offering that, for example, from the Department of Supportive Care that we're housed in, would be something that you in particular or someone you know would be interested in? Then that's information that we would need to hear about, because again, we are not trying to make an assumption that we know better. What we're trying to actually do is very pragmatically and existentially say, well, what would I do if my husband were, or if I were to be diagnosed with cancer and I wanted my husband to come and visit me or be part of the treatment journey, or my wife or my extended consensual non-monogamous family system, chosen family system. I hope this answer wasn't too vague, but it's I just want to emphasize that we are an open system in development and that we really need input from the community as well to get it right. We want to get it right. We won't always get it right, but to get it right, we need your input.
And just if I can add, Christian, just also a shout out to Wellspring, is that I think they've had the longest running cancer support group for gay men. So that's really awesome. There has been a few lesbian support groups that have kind of come and gone. Right now, we're not aware of any that are running that are specifically cancer focused.
So then I just want to honor the last two comments. Laurie Bodley has, I hope I've pronounced it correctly, Laurie Bodley. I found the website easily too, and sorry for making my comment retitles and chosen names anonymous. Didn't mean to do that, and thanks again for this important work you do. We thank you for having been here. It was a real pleasure. Thank you so much for having made the time, and we're done.
Thank you, Christian. I also wanted to mention there was another comment. It would be, we do have, Wellspring does have the gay men's support group, and the comment was it'd be great if we also had a group for the broader queer community instead. So I just responded to Catherine, letting you know that I will bring that back to the team. I know we are in discussion to be more inclusive, and I think we have had the lesbian support group previously, but I think uptake and demand just wasn't there, so we couldn't keep up that group. But I will bring this comment back to the team, and hopefully we can put some more thought into something that is more inclusive and caters to that too. So perfect. I just saw something else, another comment. Thank you so much for this great information and presentation. So I just wanted to say, Brendan, Margo, and Christian, thank you so very much for this presentation and bringing all your very important perspectives to the table and sharing your knowledge and what you are working on that is so very important to the table. And we very much just appreciate your time today.
Thank you very much. Have a good evening, everyone. Stay healthy and safe, and be in touch with us.
Thank you. All right. Take care, everyone, and have a wonderful evening. Thank you so much.
Great. Thank you. Bye-bye now.